Let's talk about getting tested for HIV. There are basically two types of tests for HIV. There's a blood test and there's a swab test. The first way is the more traditional HIV test. It's called the Western blot test. And that you usually have after 3 months of an exposure. An exposure means any time that you might have been exposed to HIV. Another way to tell is to test blood test after around 28 days of an exposure, and you can tell from that the viral load, how much blood is actually in your system. The difference between those two tests, however, are that the viral load test is often more expensive, not performed as often, and really used more for people who are at high risk for exposure. The Western blot test, very inexpensive, you can often get it for free. The oral swab test is where they use like sort of a Q-tip that has a little more abrasiveness to it, and they take cells from your cheek and they send those to a lab and you would get results from that. Those are the basic types of tests for HIV. You can get tested usually at some sort of family planning clinic. Your doctor can do an HIV blood test. Sometimes they have free HIV testing available through vans that go around in communities, and you can probably find one of those in your neighborhood. Or you can get a blood test by ordering Home Access Express, which is an online test you order. It comes to your house. You do the testing yourself and then you send it in and call for your results. If you feel like you have been exposed and you are fearful that you might have been infected, the only way to know is to get tested.